Assalamu alaikum. We are pharmacy students in Al-Mashriq University. Our presentation about 2016 ACC AHA guideline focused update on duration of double antiplatelet therapy in patients with coronary artery disease. Airports, American College of Cardiology, American Heart Association Task Force on Clinical Practice Guidelines. Introduction. The document is focused update from the American College of Cardiology and American Heart Association. It addresses double antiplatelet therapy, the combination of aspirin and B2Y12 inhibitor, the managing patient with coronary artery disease. This update revises previous recommendation from multiple guidelines by considering latest clinical evidence. The primary focus is on determining the optimal duration of DABT to minimize risk like stent thrombosis, a blood clot inside a stent, and measure bleeding.
So we will discuss evidence-based recommendation on the duration of dual antiplatelet therapy to optimize outcome in patients with a coronary artery disease. Our first goal is to provide a clear recommendation on DABT duration. Second, we emphasize tailoring therapy based on stent type, bleeding risk, and ischemic risk. Finally, we simplify previous guideline to assist clinicians in making decision in various clinical circumstances. So, the methodology, the recommendation are based on a systemic review of evidence. So, we analyze study comparing first the short-term DABT from 3 to 6 months to the standard 12-month therapy. Extend the DABT 18 to 48 months to the standard 11th month. The study including patient post myocardial infarction and undergoing elective stent placement. The results show the high bleeding risk patient benefit from short DABT duration. Patient with a low bleeding risk and a high ischemic risk may require extended therapy. Okay, this flow chart summarizes the treatment algorithm and categorize decision based on a clinical condition. Patients are divided into this with a stable ischemic heart disease on the left and this with an acute coronary syndrome on the right. تمام. The decision focus on the stent type اللي هو parametal stent BMS or drug eluting stent DES. تمام. Simply put, patient at high bleeding risk require shorter therapy duration, and patient at high ischemic risk may benefit from longer therapy.
Result: shorter dual antiplatelet therapy from 3 to 6 months, suitable for low-risk patients with a drug-eluting stent. Reduces bleeding risk significantly but may increase the chance of clot formation in the high-risk patient. Longer dual antiplatelet therapy from 18 to 48 months reduces the major adverse cardiac event such as heart attack or stent thrombosis but increase the bleeding risk. Most beneficial for high-risk patients, such as those with history of the heart attack. Balance of the risk and benefit. Individualized decision-making is critical. Factors like age, diabetes, history of the prior MI, myocardial infarction, or stent type are key considerations.
Conclusion: dual antiplatelet recommendation should be balanced ischemic risk and bleeding risk. Ischemic risk of blood clots and stent-related complication. Bleeding risk of significant bleeding, especially in older patients of this anticoagulant. This update emphasizes patient-specific therapy guided by clinical guidelines and patient preferences. Aspirin is atypically quoted identically, while the B2Y12 inhibitor. Example: clopidogrel is stopped based on risk factor.
After stent implantation, at least 12 months of the dual antiplatelet therapy is recommended. Continuation beyond 12 months may be reasonable for patients at high risk of the ischemic event. For high bleeding risk patients, discontinuing of the dual antiplatelet therapy earlier, such as after 3 months for the ischemic or 6 months for acute coronary syndrome, may be acceptable. A risk scoring system such as a dual antiplatelet therapy score can help predict whether a patient will benefit from longer therapy or not. Comment: this guideline adopts a modernized, clinical-friendly approach. It emphasizes individualized care. It integrates a new data while homogenized period recommendation. The treatment algorithm provides clear step-by-step guidance to help clinicians manage complex cases. And thank you.